Hello everyone, welcome back to Sadok Health. My name is Dr. Dan and I'm here with Dr. Jobert Dodge. An uncommon question, but quite an interesting one. Many couples are going through this problem, but of course they keep quiet. So today, someone asked about painful sexual intercourse.
Something that shouldn't be ignored, definitely.
You ought to know your health. What is painful sex, Dr. Harry?
To make us understand this, maybe I will try to classify painful sex. Okay. The medical term is dyspareunia, but I will stick to painful sex. So to classify this, we shall look at superficial painful sex and deep painful sex. Okay? And remember, pain is something that is different from one person to another. Pain is either physical or pain is emotional. So someone may have painful sex depending on their pain threshold.
So Dr.
Yes.
Now that we have known what painful sex actually is and its classification really, what are some of the things that will cause one person to have painful sex and the other person is completely okay?
To understand the causes of painful sex better, I think we'll look at it depending on the classification. Superficial causes and deep causes. When we look at the female genital organ, there is the external and the internal.
Yes.
So superficial, I mean the external. We are looking at the structures like the lips of the vagina, which we call the labia, which is labia minora, there's labia majora. Out there we shall also find the clitoris, and then we shall also find the urethral opening. So superficial causes can affect any of those, okay? Can affect any of those. In medical term, we call all that the vulva. So the superficial causes, the first one we can always think of is genital injury. Just take a look at someone who is shaving, then probably they injure the labia. Then in the healing process, definitely there'll be pain. Or maybe after childbirth, you get a tear. When you have sex, that trauma, definitely you'll end up with pain. And then besides that, we look at infections. We have talked about urinary tract infections, specifically the urethral opening. You know, it is within the perineum. So if it is inflamed because of that infection, during sexual intercourse, especially during penetration, the initial stages, someone will feel pain. Other infections like yeast infection. You know, with a yeast infection, there's inflammation, there's ulceration and irritation around the vulva. It can be the lips of the vagina, inside the vagina itself. So when the penis penetrates the vagina, in that process, superficially, there is that pain because of the inflammation. The other things like warts, you know, warts, that's a growth around the perineum, okay? It's non-cancerous. Because of the growth, it has nerves. During penetration, you find that what? There'll be pain as well. We can also look at vaginal disorders, like some people, the hymen, which is that covering along
the membrane. Yeah,
it's a membrane along the vagina. As someone grows, it is supposed to give way and open up the vagina. But for some people, it may not open up fully. So during sexual intercourse, especially during penetration, someone will what? Will feel pain. There's one particular thing called vaginismus. Vaginismus is like that squeezing of the muscle in a way that it closes up the vaginal opening. So penetration cannot happen. So if vaginismus happens during sexual intercourse, it's impossible to have sex. One of the most common causes, especially of superficial painful sex, is vaginal dryness.
That one.
Yeah. So you find that a woman is not secreting enough of the vaginal fluid. So how does this come about? For example, when someone has not been aroused, there is no enough vaginal secretion. There will be pain because of friction. So what I'm saying is, maybe you spend a longer time during foreplay, and you get aroused better.
Okay.
Vaginal dryness can also happen in mothers who have just given birth, or women in menopause. Why? Because the hormone estrogen reduces, and remember, estrogen is responsible for the vaginal secretion.
Yeah.
So if you are breastfeeding, or you have just given birth and you are having painful sexual intercourse, it's majorly because of the reduced hormone called estrogen, and then definitely during menopause as well. Then what about the deep painful sex? Deep, I mean we have left the outer opening already, and the penis is now within the vagina. Okay, so to make us understand this, I will divide it into the medical conditions that will cause deep painful sex, and the medical treatment or therapy that will cause deep painful sex.
Okay.
And I will start with the medical conditions.
Okay.
And the first one, we have talked about this before. If you didn't watch our video about pelvic inflammatory disease, please check up here. Pelvic inflammatory disease, this infection, majorly bacterial infection of the cervix, of the uterus, the fallopian tube, okay, the ovaries. So remember, with infection comes inflammation. And then when these infections heal or they are treated, sometimes bands form in between these organs because of the healing. You find the uterus is closely, you find the ovary is closely attached to the uterus, the fallopian tube has reduced in size, the cervix have formed bands. So definitely during sexual intercourse, the deep pain comes in, especially now when the man is thrusting. Okay? So you find that because of that movement, it's not freely moving. The organs are all attached together, and that tension force causes the pain. The other thing we have talked about always, endometriosis, when the inner lining of the uterus is everywhere, outside the uterus and everywhere. That can also cause what? Painful, deep, painful sex. We have also talked about ovarian cyst before. You know, with the ovarian cyst, there is that collection of water around or near the ovary. So just imagine the penis is already deep in the vagina, and definitely there's that thrusting movement. The cervix, the uterus is moving, knocking the cyst in sideways, backwards. At the end of the day, there is going to be pain. The other cause could be fibroids. Yeah. Remember, we talked about fibroids. If you have not watched the video about fibroids, check up here. Yeah. Fibroids will also cause painful sex, and it's majorly because of the tension. The tension movements during the thrusting, and someone develops that pain. The other thing we talked about is the medical therapy, medical treatment that can also cause what? Deep painful sex. You have had a surgery on the uterus. You have had a surgery on the cervix. Or maybe you have had a surgery in the lower abdomen, maybe to pick something or to repair something in the lower abdomen. And remember, when wounds are healing, they heal with bands. Everything comes together. The uterus is attached to the intestines. The cervix is also attached to the uterus. And remember, deep painful sex is when the penis is within the vagina. So that thrusting movement, everything is moving, but there's a lot of bands everywhere. It's like tension here, tension left. There's definitely going to be pain. Not pain, all painful sex really has a cause, or maybe there's something wrong with the pelvic organs. Sometimes it could even be the position. Some people are comfortable in certain positions. When they try other positions, they feel pain.
So, doctor, you talked about now the physical pain, and you really described it very well.
Yeah.
What about the emotional pain?
Okay. Yeah, like we said, pain can either be physical or emotional.
Yeah.
So for emotional pain, especially emotional painful sex, this is something that is more of psychological. Like for example, maybe as a child, you were a victim of sexual assault. Or maybe at a given point, you were raped. Definitely, when you try having sex again, the mind still remembers what happened. Of course, it's very traumatizing. And the truth is, you will end up feeling pain. Actually, some people will not have sex peacefully again. They will not enjoy sex because it reminds them of what happened, and that causes pain. The other thing is anger. Okay? When you are not in good terms with your husband, definitely you getting aroused is not easy. So you find that at the end of the day, the vagina is dry because you are not aroused because of the anger you had. And this can be also the same thing with stress. When you're stressful, you easily don't get aroused. So you'll end up with a dry vagina. So painful sex comes in. Certain mental conditions, especially like depression. Depression is underlooked. Someone who is depressed definitely pulls away from all the enjoyable things they used to do. They feel like they don't want it anymore. So just imagine such a person, maybe is married, has a partner, and the partner doesn't know what is going on. So such a person will also have what? Painful sex because they are not aroused. The vagina is dry. To treat painful sex, I will start with the emotional causes first. How do we treat emotional causes of painful sex? What I can say is, the best bit is to always have adequate foreplay. When foreplay is adequate, definitely the mind is set that, you know what, you want to have sex. Like we always say, to treat painful sex, we always treat the what? The cause. So whether it's superficial causes or deep causes, we have looked at them. If it is an infection, a urinary tract infection, get it treated. Okay? If it's a yeast infection, get it treated. If it's an injury that you have had because of childbirth or because of shaving, let it heal before you try sex. Okay? That is for the superficial ones. For the deep ones, if it's a fibroid, it will be treated. Again, if you have not watched our video on fibroids, check up here. If it's endometriosis, it can be treated. If it's a bladder infection, it can be treated. So, majorly, treatment of painful sex, whether it's superficial or deep, the treatment is to treat the cause.
So are there certain things that someone can do out there to try to, avoid this problem? Because I understand, for example, emotional pain is even probably much more than physical pain. So
Yes.
what could someone do so that they could, overcome this problem?
So, besides treating the causes that can be treated, and then like emotionally, you have to sort out all that is causing you the emotional withdrawal, which will reduce your arousability. Like for example, there are certain things that can be, like for example, there are certain things that could help. Okay? Like for example, vaginal dryness. There are several lubricants in the market. A good example is KY jelly. So you find that it could help. You apply the lubricant before the penetration. But I would say use water-based lubricants. You have had situations where, for example, you are using a condom and then you apply Vaseline to help maybe to reduce the friction. Vaseline and rubber, definitely, it will break down the rubber. So use water-based lubricants. If this is the case, please get it prescribed. Don't just go over the counter and buy any lubricant for sex. Like I said, sex is supposed to be something enjoyable, okay? Because for a married couple or for someone and their partner, that is something they will definitely look forward to. So, to recap, if you are having painful sex, please don't stay home. See a doctor because there's a solution for everything. You wouldn't want to compromise your emotional health or emotional satisfaction because you are not having good sex. Okay? So, seek medical advice if this is the case.
Thank you very much, Dr. Job. To our viewers out there, I hope you've watched to the end of this video and you've liked it. Our aim is basically to make sure that you have a lot of information so that you can know when to visit doctor and probably when to not worry about anything. So if you're new to this channel, don't forget to like, share and subscribe. Hit the notification button so that you can be notified once we upload our next videos. Sedok Health,
Ask the doctor.